Srijandeep Kumar.
Good morning everyone. I am going to present a case of upper eyelid coloboma managed with Tangel flap technique. Eyelid coloboma is a congenital defect of the eyelid margin that results from incomplete fusion of the embryonic fissures. It can cause cosmetic deformity, exposure keratopathy, corneal ulceration, scarring, neovascularization and thereby visual impairment. The treatment of eyelid coloboma depends on the size and the location of the defect, the condition of the ocular surface and the patient's preference. My case, a 27-year-old girl presented with upper eyelid defect in the left eye since birth with corneal opacity and subsequent diminution of vision since childhood. Corneal opacity developed following a history of red eye ache and discharge at the age of 4 years. There was no history of any ocular trauma or ocular surgery. No history of any systemic comorbidities was there. On examination, she had upper eyelid coloboma medially, which was around 12 mm in length, causing 50% defect in lid margin. There was exotropia of the left eye. Visual acuity in the left eye was finger counting close to face and right eye was 6/6. IOP by Sears was 10.4 mmHg of left eye. Extraocular movements were full, free and painless in all directions in both eyes. There was adherent leukomatous corneal opacity of 4/4 mm in dimension with superficial neovascularization of cornea at the exposed part and shallow anterior chamber. USG scan of the left eye was normal. Now my patient was diagnosed as a case of congenital upper eyelid coloboma with leukomatous corneal opacity and sensory exotropia of left eye. Patient was initially managed with antibiotic eye drop, lubricant and oral antibiotic. Eyelid coloboma reconstruction by direct appositional closure with Tangel semicircular flap was done. Here a carved incision was made at lateral canthus, extending it laterally, creating a semicircular flap from the lateral canthus. Then flap was mobilized medially. It was sutured with the defect margin. The donor side was closed with interrupted sutures. The patient had an uneventful postoperative recovery after eyelid coloboma reconstruction. The patient had improved eyelid function, cosmetic appearance and ocular surface protection. Now this is the picture showing the patient before the surgery and 3 months after the surgery. The patient further planned for cosmetic penetrating keratoplasty and exotropy correction for cosmetic purpose. Eyelid coloboma reconstruction by direct appositional closure with Tangel semicircular flap is an effective technique for medium-sized defect. Our case reports adds to the existing literature to the management of eyelid coloboma. The aim of this study was to report a case of upper eyelid coloboma that was managed by eyelid coloboma reconstruction. We achieved good functional and cosmetic result for eyelid. We suggest that eyelid coloboma reconstruction by direct appositional closure with Tangel semicircular flap is an effective technique for medium-sized defect. Thank you.
Any questions? I think 50%, up to 50% of the lid coloboma, if it is a 50% defect, it can be done by the direct apposition, and anything beyond that probably we will need a flap graft. So they have done it's a simpler procedure and less time consuming, so nicely done, and they have followed it up with PK and cosmetic surgery, so a good cosmetic. Any questions from the audience?
Thank you, sir.
Thank you.